I want to go ahead and do brachial pulses. They're in between the bicep and the tricep. They're very close to the axillary area, and I'm feeling them and just noting that they are equal and that they are strong. I don't need to count them for a full minute. Looking at the hands, I'm looking at the number of digits. I see that I have only 5, so I have no polydactyly, which is a genetic problem if it was present. And I'm looking also for webbing of the fingers, which would be an indicator of syndactyly, which is a genetic problem. And I do not see either polydactyly or syndactyly. Looking at the nail beds, they do reach the end of the fingertips, and that is a good indicator of genetic gestational age. I'm also going to look for a simian crease, which is found with children that have Down syndrome. It's not conclusive. We still would have to do DNA testing, but it would be an unbroken transverse line on the palm, and I do not see one on this baby. There are 2 reflexes that I can check on the hands. As I lift the baby up, the baby grasps my hand strongly and allows me to almost lift him off of the bed, so he has a strong grasp reflex. While I still have him lifted up, his head is on the bed, but his shoulders are off the bed. I'm going to release the hands abruptly. And the baby should tremor, form a C with his forefinger and thumb, and then retract his hands back to a flexed position. Those are indicators of a positive or strong Moro reflex, sometimes referred to as a startle reflex. All right, now I'm going to assess the chest. First, I look to see that it is symmetrical, and I'm going to look at the breast tissue to see if I see any engorgement. I do see a little bit of engorgement, and that is a reflection of mom's hormones. It'll go away in a day or so. Looking at the breast tissue, I'm wanting to see if there is any puckered, stippled area around the areola, and I want to feel for a little bud. These are indicators of gestational age, and this baby is having a term appearance. Looking at the abdomen, I can go ahead and check capillary refill, and it's less than 3 seconds, so good perfusion. And I've already listened to bowel sounds. As I look at the abdomen, I see that it is round, which is normal for an infant, and I'm going to lightly palpate to see if I feel any masses, and I don't. Looking at the umbilical cord, I notice that there are 2 arteries and 1 vein. The arteries are more erect, and the vein is kind of flat and wide. I see Wharton's jelly on the cord, which is a protection around the cord, and these are normal findings. I do not see any drainage, nor do I see any bleeding, and the clamp is still in place. Moving on down to the legs, I'm going to see if they have good range of motion. I do. I'm going to put my thumbs on the knees and straighten the legs out. And as I do, I want to see that the heels come to the same place and are equal length. This mannequin doesn't really show that. Unequal length is an indicator of hip dysplasia. If I did have unequal length, I would not do any further manipulation of the hip joint. Looking at the feet, I see that I have 5 digits on both feet. So I have no polydactyly, and I do not have any webbing, so I have no syndactyly. The nail beds are at the end of the toes, so they are equal length. And looking at the soles of the feet, I'm looking at the creases. I know creases start forming near the toes and work their way towards the heel as the baby gets further in term. So this is a good indicator of gestational age. And I notice that this baby's has creases on the entire sole except for the heel. The heel is still a little bit slick. So this baby is very close to term in appearance on the feet. I have 2 reflexes that I'm going to test. I'm going to press under both feet at the same time under the toes, and the toes curl over my finger, and that is a plantar reflex, and that is normal. And I'm going to take my thumb, I'm going to scratch the baby's sole starting at the heel and flip up towards the toes, and as I do, the toes spread out, and that is a positive Babinski, which is a normal finding in a newborn. Now I'm going to turn this baby onto its abdomen, And I'm going to check the back. First, I noticed that on the shoulders there's some fine downy hair called lanugo, and that is a normal finding that there's just a little bit at term. I'm noticing a tiny bit up here on the cheeks too. So far I've not seen any vernix caseosa, that white cheesy protective skin substance, but I'll look in the genitalia. A lot of times the deep creases is where you see that. As I look at the spine, I see no obvious spina bifida, and the spine is feeling straight and intact. And I go all the way to the base of the spine, and I do not see a sacral dimple, and I do not see a hair tuft sticking out of it. So no occult spina bifida. This is a light complected baby, so I would not expect to see Mongolian spots, but I would if it was a dark complected baby. They are normal findings on dark complexions, and they can be at the sacral area or any other area of the body. I did not see a stork bite at the back of the neck, and as I'm looking overall at the skin, I have not seen any birthmarks. Looking at the buttock area, I am looking to see if the anus looks patent, and it does. In fact, I have meconium in the diaper, so I know that I have a patent anus. I'm looking at the gluteal folds, and they are equal on both sides. This is the second indicator that the hip is in the socket and that I have no hip dysplasia. Turning this baby back over, I want to look at the front of the genitalia. This is a little girl. First thing I want to do is to check for bladder distension. I palpate right above the symphysis pubis, and I do not feel any bladder distension. And as I had opened the diaper, I also saw a little bit of urine. It should be clear yellow, or sometimes it has a little orange cast to it because of the little crystals that are in it at the first time they void. I'm going to feel the femoral pulses. They're on either side, right across from the symphysis pubis, and they feel strong and they feel equal. Looking at the genitalia, which will tell me gestational age, I notice that the labia majora is closed, which is a term appearance. If it was open and I could see the labia minora or the clitoris, then that would be preterm. I also am looking to see if I see a hymenal tag, which is a little tissue, almost looks like a little tongue or tag that sticks out at the base of the vagina, and I do not see that. It is a normal finding if you do. And I also sometimes will have a pink tinged mucus coming from the vagina called pseudomenstruation. That is a reflection of mom's hormones, and it'll go away in several days. At this time, I'm done with this assessment except for doing ortolani. I've already established that I have equal length of legs, equal gluteal folds, so I can feel comfortable doing ortolani. I want to take my ring finger, place it in the trochanter at the head of the femur on either side, and then I'm going to abduct the legs. And as I do that, I'm feeling with my finger for any sensation of the head of the femur popping out of joint, and I'm listening for a click. And I do not hear a hip click, so this is a negative ortolani. I would change the diaper at this time, and I would be done with the newborn assessment for the little girl. After changing the diaper, I would change my gloves. I could do cord care. I'm going to leave the baby under the radiant warmer. This is safe. The rails are up.